Professor Teo Yik Ying is here to weigh in. He's the Dean of NUS's Hock School of Public Health. Welcome to the show, Professor. A reduction of social group sizes, working from home as a default, more measures to protect younger kids. Prof, the task force says the aim of these measures is to slow down the transmission rate. Your thoughts, Professor, given that pulling back on reopening seems contrary to our endemicity stance?
Thank you for having me. So yes, today we heard the need to tighten safe management measures once again, and the measures that will have the biggest impact, I believe, will be the scaling back of dining in, social gatherings, and household visitors from 5 to 2. And I think my colleagues and I, we have always been saying that the journey to endemic COVID is going to be filled with uncertainties, and we shouldn't hesitate to tap the brakes when there's a need. And at this point, I think it's important to start off by emphasizing that given the number of infections that we see daily in Singapore, right now we have about 16,000 cases in the past 1 month. Actually, we continue to learn that the vaccines we use in Singapore are highly effective at preventing severe disease and death. So the tightening of the measures is not a sign that the vaccines are not effective, are not working. But because Singapore has chosen to be extremely prudent in hospitalizing infected cases who are older and who may have underlying medical conditions, despite the fact that many of them actually have no symptoms or have mild symptoms. This is the reason why our hospitals are filling up. So as a country, we are taking steps to move some of these patients to the community treatment facilities, which will continue to provide a high level of clinical monitoring in case the symptoms should worsen. But I think this moving of patients will take time. And equally, the home recovery scheme that we have rolled out, because of the sheer number of infected cases, you could see that we have quite a bit of operational hiccups. So tapping the brakes now will modestly reduce the level of people interacting in public, and actually to provide the time for home recovery operations, for the transfers to community treatment facilities, the transfer to community care facilities to be ramped up. So the key now is to make sure that our hospitals regain the capacity to look after those who truly need to stay in the hospitals. Otherwise, the hospitals are filling up, not because we truly have 1,000 over people who need the hospital care, but because of our very cautious protocols that we are putting these people in the hospitals.
To prevent overtaxing of our healthcare capacity, what could be other potential weak links as we ride out this wave?
So you talk about the weak links, and I think it actually depends on how you define the weak links. Because is it defined as settings where we see more clusters happening? Or actually, at this stage, should we be defining weak links as infections happening in settings where there are more unvaccinated people? I actually believe that we should focus on the second definition. How do we ring-fence these settings where there are more unvaccinated people or people at higher risk of disease and death, or which will be those who are very frail, immunocompromised, or with serious chronic diseases? So the weak links that I'm thinking about will be hospitals, nursing elder care homes, and even primary schools, because we know our children under 12 are still not vaccinated. And also, let's not forget about those multi-generational household settings where grandparents and grandchildren do stay together. And because right now, I mentioned earlier on, we see very consistent evidence that people who are vaccinated really do have a much lower risk of severe disease, which is exactly what increases the need for hospital care. So we hear the ministers talk about our journey to endemic COVID. It really still comes back to that bottom line of getting as many people, especially those that are vulnerable, to come forward to be vaccinated.
Professor, like you stressed, apart from reducing the risks of severe illness, another benefit to vaccination is a return to normalcy, and some may be disappointed, frustrated, fatigued by today's announcements. What's your message to these people?
Yes, indeed. I think since the start of this year, we have been saying that vaccination will be the key to allow us to return to some degree of normalcy. And yet, despite this, over the past 3 months, we have seen repeated tightening of measures, especially given our rising vaccination rate. So I think the journey to endemic COVID is one that many countries in the world is currently still learning as they proceed. There's no textbook answer or 10-year series answers for our policymakers to learn from. And I think more importantly, there will be certain hurdles that must be crossed in order to reach that long-term and sustainable strategy of living with COVID. And I think it's important to highlight here, one of the key strategies is for people to accept the fact that most of us will be exposed and infected with COVID at some point in time, because vaccination and natural infection are exactly what is necessary for us humans to adapt to the coronavirus, just like what we have been doing all this time, adapting to endemic infections. So people have been asking, so what exactly is this endemic COVID game plan, and why do we keep shifting between opening and retightening? I think we are now at from the beginning of the pandemic, we see that when a person is infected, infection actually triggers a natural immune response such that the person is highly unlikely to be infected afterwards for some time. And some countries actually, like Sweden, the UK, tried this approach of natural exposure in the beginning to try and live with COVID before they realized that actually the number of cases with severe disease and death will rise so quickly that it overwhelms the healthcare services. But right now, we actually have highly effective vaccines, which basically reduce infection to one with no symptoms or mild symptoms for the most part of the population. Now, in this situation, if one is infected after having been fully vaccinated, it actually means that there's going to be an additional natural boost to the immune system that helps to ward against subsequent infection. And because the vaccine reduces the risk of disease and death, that is why we say the journey to endemic COVID will happen through vaccination, through natural infection. So we must be mentally prepared to see rising case numbers, especially when most people in the society can be protected against disease and death. But our national strategies and protocols must be ready to handle these rising case numbers and to isolate them appropriately in different settings, whether it's the home, community facilities, or hospitals, so as we minimize the overall harm to individuals and the community. And that means we have to be very prudent in how we decide who are the people who truly need to stay in the hospitals.
Thank you for your perspectives and your time, Professor. That was Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS. Now you can visit straitstimes.com for more from today's press conference.